Hey guys, what if I tell you that almost every day millions of people reach for eye drops thinking they are doing the right thing? But what if I tell you that this the same eye drop which is meant to heal, to cure, or to take away your eye ailment might be causing serious harm, serious devastating health challenges ranging from blindness to loss of life. But right in this video, I will dive into the hidden truth about the use of eye drops, the life-saving hero for some people, the silent killer for others. Before you use any eye drop, make sure you watch this my video to the end. Like, comment on my video. Make your comment, ask your question, and I will respond appropriately to it. If you are watching my video for the first time, please kindly press the subscription button, subscribe to my channel by clicking on the subscribe button. And if you are a returning subscriber, God bless you. I'm that your humble brother and your friend, Stephen Oluwatumininu. Now, let's talk about the use of eye drop, the life-saving hero and also a silent killer. I will start by citing to you some scenarios for you to really understand how serious the associated, dangers associated with the use of eye drop could be. Number one, there was a woman that was suffering from, itching, serious eye discomfort. Instead of her to go to the hospital, she told a friend and they gave her a series of, cultural practices to the eye, like applying onion, applying all these things, whereby she was suffering from just allergy. As a result of all these cultural applications, the eye got infected to bacterial conjunctivitis. The eye was now discharging seriously. When she wake up, the lids, got stick together by eye discharge. Now, she now went to a pharmacy and made a complaint. Now, as a result, she was now given an eye drop called dexamethasone, which is a steroid. And mind you, steroid is strictly avoided in bacterial conjunctivitis because it's just like when you plant a corn and now apply fertilizer. That is exactly how it is with the use of steroid in bacterial conjunctivitis. Steroid will further, favor the growth of all these bacteria. To cut the long story short, the eye got seriously infected. She now got to the clinic. On arrival to the clinic, on examination and when we took her history taking, the eye already was suffering from endophthalmitis, which is total infection of the eyeball. We were able to battle with the infection, but to cut the long story short, she lost the two eyes because the cornea has already been affected with the infection. And cornea usually heal with opacity and light don't travel through opaque medium. That is how serious eye drop could be. Let me tell you another scenario, which there was a lady. She was an asthmatic patient. Now she got to the hospital to lodge her complaint of serious eye discomfort. Now she was now diagnosed of having glaucoma, which is, increase in intraocular pressure of the eye. But because she was not fully prepared, she couldn't get her drugs because she didn't have much money with her. Now, when she now got her drug, she went back home. And mind you, the hospital policy, they don't usually release their prescription, except you buy your drugs and drop it in the pharmacy. Now, when she now got the money like a week after that, instead of her going back or directly to the hospital, she went to a health practitioner. Explained to her that in the hospital, they said she had increase in intraocular pressure and she didn't have money to purchase the drug. The health practitioner just said, yes, they use Timolol to treat glaucoma and, increase in intraocular pressure. They now prescribed that she should buy Timolol. She got the Timolol. She started using it. It was the second day she is now suffering from, serious dyspnea, which is difficulty in breathing. This was what even brought her to the hospital. She was rushed to the hospital. On examination and on history taking, we realized that she was using Timolol. Meanwhile, Timolol is strictly contraindicated in asthmatic patients. Do you know why? Timolol is a beta blocker drugs. And we have beta receptor cells in the heart and also in the airway. The beta receptor cells are located in the smooth muscles lining the airway. The function of the beta receptor cells is to dilate the airway to allow a free flow of air into the lungs. Now, the use of timolol into the conjunctival sac, which is the right place to put the eye drop, now travels through the nasolacrimal duct into the systemic circulation. It got absorbed and it went to go and antagonize or block the receptor cells, because the drug is a beta blocker. It blocked the receptor cells in the airway, leading to vasoconstriction. And whenever there's vasoconstriction, it will narrow the airway, preventing the free flow of air, leading to difficulty in breathing, which is a life-threatening condition. You can now see how serious the dangers associated with the use of eye drops could be. Now, let's talk about the important point to know that is surrounding the use of eye drops. The number one is, eye drop is recommended to be used for 4 weeks. Do you know the reason? The preservative content, which is called benzalkonium chloride, can only last for 4 weeks. And after 4 weeks, it is no longer effective, meaning the eye drop is no longer valid for use. And majority of people don't even know this. They begin to use their eye drops till it's finished. Some even use it to the half, of way, and they keep the remaining one for another, similar occurrence of such eye ailment. It is very, very bad. Once the preservative content is no longer effective or valid, the eye drop can favor the growth of bacterial organisms that can cause you a serious eye challenges. Please, let's note this and avoid the use of eye drop longer than the prescribed duration. It is prescribed only for 4 weeks. And if we even look at the volume, if it is being used the right way, it is only meant for a month. Another one is avoid self-medication. Let me start this by citing to you another scenario of a man that got trauma to his eyes when they were playing football. He was now suffering from a serious eye pain that he could not bear. He now went to a pharmacy, complained to them that he was having a serious pain in the eye as a result of trauma to the eye. Now they gave him a drug called atropine. He instilled the atropine, and immediately, just about 2 hours after, he could no longer see. He was having a blurry and foggy vision, and also could no longer even focus at the light. He couldn't go out of the house to even focus at the sun. He was rushed to the clinic. On examination of the eye, I realized that the pupils were widely dilated. I now asked him, what really happened? Apart from the trauma you had, it's like you've instilled a particular eye drop. He said, yes. I said, do you remember the name of the eye drop? He could not remember. I now told him, I suggested, is it atropine or cyclopentolate? He said exactly that. It was atropine. I now simply told him, I said, sorry to tell you this. You cannot see until after 2 weeks, meaning 14 good days. Because the effect of atropine lasts for 14 good days. It is not meant for what it is being used for. It has been used wrongly. And there has not been any drug done to counteract the effect of the drug called atropine. So let's avoid self-medication. It could be very, very bad. When you have any, discomfort in your eye or any complaint, move to the nearby hospital or an eye specialist for early diagnosis, proper diagnosis, and adequate treatment. Another one is avoid sharing eye drops. There are 2 reasons that, is backing this. Number one, eye drop sharing can transfer an infection from one eye to the other. And, the purpose why the eye drop was actually prescribed might not be the same purpose with you, which could lead to a serious, devastating effect to your eyesight. Another one is some eye drops are fortified. For example, during the time of hemorrhagic conjunctivitis, that is Apollo, I do fortified eye drop for some people. That is, I use injection. I withdraw, some volume of injection with a particular dosage. I put it in the eye drop. It is scientifically proven and it is evidence based. It can only be done by an eye specialist, mind you. Thank God I didn't even call the name of the eye drop and the name of the injection I used. So when I fortify this eye drop, I usually write broadly on it, fortified. Anything that has been fortified, it means the composition has been changed. And I do, do this to increase, the potency of the drug, to increase the concentration. Because I look around, most of the drugs that has been manufactured is not to the concentration that I want. So I do it to my own concentration, I mean the desired concentration. If an eye drop is shared, someone that I prescribed it for or that fortified it for will cause it will bring about a relief, curing any eye disorders in that eye. But if it is being used by another person, it could even lead to blindness. This is one of the reasons why we have to avoid sharing eye drop. Another point is instill eye drop correctly. Where do you instill eye drop? Majority of people will put eye drop directly on the eyeball. Some people will tell you put it at this corner. Some people will tell you put it. No, it is very, very wrong. Eye drop should be instilled in the fornix of the eye. That is, when you pull down your lower lid, this pocket that is right down there, that is where you put eye drop. And if you look at the thumbnail that covers this my video, you will see a young man where he's putting his eye drop. That is the right place to put the eye drop. We call it conjunctival fornix or conjunctival sac. That is where an eye drop can be absorbed. If you instill eye drop on your eyeball, the tears will immediately be produced and push away your eye drop, and it will not be absorbed, meaning the effect or the intention of using it will not be achieved. Please, let's note this is very, very important. Another point is use a prescribed eye drop for a diagnosed condition. Before an eye drop could be prescribed by an eye specialist, there must have been an eye diagnosis that he has seen before he could have prescribed the eye drop. But instead, most of people do it other way around. Let's learn to use a prescribed eye drop. Go to an eye specialist. If you have any eye complaint, let the eye specialist prescribe an eye drop for the diagnosed condition. Not that an eye drop has been prescribed for you now, you use it now and you keep it for other day, then another time you have a different eye ailment or maybe a similar complaint, and you go and pick the same eye drop. It might be very, very wrong. It might prove very fatal. Let's avoid this. Another thing is, let's avoid the use of eye drops for cosmetic purpose instead of therapeutic purpose. I've seen majority of people coming to me that they want to buy eye drops, that can clear their redness in the eye. Some of these are smokers or substance abusers. And most of these eye drops that they most of the time go and buy, like Vicin and some of these eye drops, just for them to clear away redness, and they are being sold to them by the pharmacy. Let me tell you, they are vasoconstrictors. They constrict the eye blood vessels that is supplying the eyes with blood, and momentarily, the eye will look white. But after the effect of the drug wears off, the redness comes back again. I will call it rebound hyperemia, which can be very, very bad. And this act can also lead to dryness in the eye and serious, devastating effects to your eye. If you have any challenges, go to the eye specialist. People that come to me, I do tell them, this is an allergy. It is being triggered by a particular stimulant. What is that stimulant? So let us get to know the cause of this redness. It is the cause that will be dealt with, and all other manifestations will wear off. So instead of, killing something at the surface, why the cause is systemically. Please, let's take note of this and avoid that act. Another thing is, don't use expired eye drop. An eye drop that you will see the expiry date are written at the back of it. The moment the expiry date has elapsed, please kindly just throw it away, because instead of healing you or curing your eye ailment, it can cause you a serious harm, leading to even blindness. Please, let's take note of this. Then you are to store eye drop in a cool and dry place. And most of you people, they don't even know this. If you buy an eye drop or you have been prescribed eye drop for, look at the back. It is broadly written there, store in a cool and dry place. Keep out of reach of children. All these are the instructions. Majority of people, because they don't want to forget their eye drops at home, they will put it in the safe of a car where there's much heat being generated. It is very, very wrong. It will change the composition of this eye drop. Let's take note. It should be kept in a normal room temperature. That is in a cool and dry place. It should not be kept in a humidified or in a wet place, because doing all this can change the composition of the drug, can distort the potency of the drug, and instead of healing you or curing your eye ailment, it will further cause additional serious devastating effect to your eye and your eyesight. Using multiple eye drops together can be very, very wrong at times. You use this because most of all these eye drops, they have their chemical content which can interact with each other, now causing a serious chemical reactions that can destroy your eye and your eyesight. So please, let's make sure whenever we have any serious eye challenges, let's go to the hospital or a nearby eye specialist, not going to a medical practitioner. There are specializations in this our field. That is why ENT is there, an ophthalmologist is there to take care of your eye. ENT is there to take care of eye, ear, and nose, and series of specializations. We have reasons for specializing in all these areas. So a health practitioner is not that the person is not good, but in that field there are some specifications which you don't know. Like the person that went to a health practitioner to get Timolol to be used for glaucoma. Truly, we use Timolol to treat glaucoma, but we have another one that we do give to asthmatic patients. And as an eye specialist, I will ask you some series of questions during the history taking to really know whether you are having asthma or some contraindicated conditions that comes with the use of Timolol. Now, when you use any eye drop and there's any complaint or you feel any side effect of it, report to the nearby eye specialist. Any complaint, any side effect should be reported. For example, this is now pertaining to the general well-being. A person was prescribed Septrin 4. Septrin is a sulfonamide, and the person didn't bother to ask, are you reacting to sulfonamide? Because it is in the pharmacy. Do you know this man took 2 tablets of Septrin and it ended his life as a result of what we call Steven Johnson syndrome? Is do occur to people that are reactive to sulfonamide. And that is why if you go to the hospital, if you look at your card, if you are someone reacting to any of these components, it will be broadly written at the back of your card, reacting to sulfonamide, reacting to any compound that you are reacting to. But most of these pharmacies, they don't know all these things. Instead of going there to go and buy eye drop, going to a health practitioner to go and ask for directives about the use of eye drop, go to the nearby hospital or the nearby eye specialist. Let them diagnose you and treat you adequately. If you've benefited from this video, kindly like my video, comment, put your comment at the comment section. Don't forget also to subscribe to my channel. Subscription is free. It can be done by only clicking on the subscribe button. Thank you and God bless you as you watch my video.